Hello and welcome to Shmu in Focus, a new podcast series that delves beneath the surface of issues important to our communities. In this series, we're exploring mental health in Aberdeen, and we will be sharing experiences, talking to communities and hearing from organisations and challenging the stigma. In this episode, we are deep diving into youth and parental mental health, and today I'm joined by quite the studio full. So if it's okay, I'd like to go around you all. If you could introduce who you are and what organisation you're from and what it is that you do.
Will I start? So I'm Catherine Lorimer. I'm a team manager for Include 'em. We're a charity that are based in Aberdeen and Scotland wide, supporting children, young people and families, and we work in partnership with Social Work in Aberdeen.
Hi there, I'm Mary Balmont. I am a team leader for health visiting and school nursing in Aberdeenshire Health and Social Care Partnership.
Hi there, I'm Dr. Emma Hepburn. I'm a clinical psychologist by day and an author and illustrator of mental health information at night, also sometimes during the day.
My name's Dr. Nerisha Pillay, and I work at the CAMS Links unit in psychiatry and mental health. It is good to be here.
Hi, I'm Rachel Thompson. I'm a health improvement officer for children and young people. And that's part of the small public health team in the Health and Social Care Partnership for Aberdeen City.
Hi, I'm Freya McDougall. I'm one of the assistant psychologists at CAMS Links unit in Aberdeen, and I work predominantly with the neurodevelopmental team and the complex care team.
So, first of all, I'd like to actually ask a question of what does mental health mean to you? And do you think there's a difference between mental ill health and mental well-being?
The way I see it is mental health is a continuum from mental ill health or poor mental health to mental well-being on the other end of the spectrum. And we all fluctuate in that continuum from time to time. We can be at different points throughout our life. And we, obviously when we're mentally unwell or if we have poor mental health, we may require treatment. However, we can look after our mental health at all points in that spectrum proactively and reactively.
And what do you feel like mental health means to yourself?
Just anybody to go?
Yeah, just anyone, yeah.
I mean, I would probably have just said exactly that. Like it's a spectrum really, isn't it? Like your mental health links in with your physical health, and like for me, it definitely like has a real connection. Like the minute you're not socialising with other people, or you know, you're not doing something productive with work, or all these little bits, like they end up really affecting your mental health. And then exercising as well is such a big thing for me, that the minute I'm not exercising, within a week I can see that the things around me are deteriorating. And so for me, that's probably, you know, like mental health is a constant, just like physical health is a constant, but you can have ill mental health and you can have ill physical health.
I've got a question as well. If you have seen an increase maybe in specific mental health conditions in attending to any of your services, and if so, what do you feel is increasing the most just now?
As a service, in my opinion, we've seen a massive increase in individuals coming in for neurodevelopmental assessments, and I think that this may be linked to the maybe not exposure, but the new softwares on the phones, for example TikTok, with their random videos saying that you have these sort of symptoms, it must mean this. And I think a lot of individuals may take this and exacerbate it.
Bit of self-diagnosis.
Yeah.
So do you feel like there's quite a high demand in people attending your service then, and you might be seeing an increasing amount of number who are potentially not so much on the neurodivergent spectrum, and it's more something that's been influenced possibly by social media?
I think there is a lot of influence by social media, but that doesn't defeat like we are a very busy service.
Mm-hmm.
But in my opinion, I think there is a lot of influence from external factors. For example, social media is one of the big ones, I would say.
Yeah.
It goes down to that public health prevention
Absolutely.
element. And you'd mentioned the importance of exercise, which I believe that's the theme for this year's Mental Health Awareness Week, and that is a kind of key factor. There's lots of elements, even drinking water. How many of us are properly hydrated? I mean, I a few years ago heard about stats where it's like if you're 2% dehydrated, your brain is 20% less has its efficacy. Eating properly. How many people truly sleep properly? Again, your social media, do people ever cut off? There's all of these sort of external influences. Social media, you look at how young people are actually seeing themselves, their self-esteem, that self-confidence, how much is it impacting on that. So yeah,
that's really interesting. When shmu brought this to me that they were doing a podcast, this specific area really interested me, and it is for quite a few reasons. So I have 5 children, 2 of which are neurodivergent, and I notice there's possible challenges within certain services, and I'm quite interested actually to hear a take on age ranges. And what I mean by that is that my daughter was 5, and I had quite a battle for about a year trying to get that support of how I can show up as that parent to look for my children's needs, but equally for my daughter to be ultimately supported. And whilst I appreciate that services are really, really busy, I'm quite interested in maybe what your insight is to that for age ranges. Is there like a minimum age that young people can actually become a part of your services? Is there a different age bracket for different areas of the services that you're involved in? How does that look like?
It's a continuum, like you say, though. Services, it's not always mental health services that support somebody's mental health. If a child's lonely, it's about getting them into group. If it starts right down even before a child's born, making sure that mum's healthy, that they know who to turn to, so that helps kind of nurture a child that they're bringing up.
I think that kind of bridges nicely as well, because I think it's really important that whilst there's young people coming into these services, we also have the other side of that, which is the guardians, it's the parents. And I know firsthand actually that sometimes parents can actually feel like they're being looked through a microscope sometimes when children are possibly being assessed. So to give you an example, my daughter, although she is now diagnosed with neurodivergency and she's got a fantastic care plan in place, before an assessment was conducted, I was investigated. And it was because when I was younger, I had mental health challenges. And what I found quite difficult within that was that whilst I appreciate that there's possible external circumstances, environmental factors, maybe poverty, different forms of neglect and things like that. And as you were saying as well, it goes right back before you're born. There could be a mum who has been on substances and things like that, which I completely appreciate. But those parents who are genuinely just seeking for that support to show up as a good parent for their child and to get that support for their child, what support is there actually in place for those parents? Because I found for myself that when I was looking to have that support and help for my daughter, I felt that at that time I was really tested, and that was something I found hard to combat. And I know that I'm not the only parent that may feel that way. So I'm interested, what support is there for the parents, the guardians involved in this as well?
I mean, I was just going to say, I guess for including, we're in a really lucky position where we work alongside like parents and carers while we're supporting the young people. And that might look that some of those parents maybe have substance misuse or offending behaviour, but for some of them as well, it's mental health challenges that they've maybe had for a number of years, and then maybe with having children that's come to the surface a little bit more, or they feel like they're under a microscope because their child might be displaying some behaviours that then mean that the schools or social work are becoming involved and maybe will feel scrutinised, as in that's their parenting. And we're in a really lucky position for our service that we can work alongside the parents while also working alongside the young person, so it's not just the young person. Because what we recognise is for circumstances to change for children and young people, their parents need to be contained and be in the best position as well. So a lot for some of our parents, that's not us doing anything specific, but it's being a person who they can turn to and who they can have those open conversations with and not feel judged and not feel like, if I say this, I'm going to be looked at as a bad parent, but being able to say it and have somebody go, that's totally valid to feel that way. How do we manage that?
I think that what your service is offering is absolutely fantastic, and I think that's a crucial part of it as well, that a lot of parents may actually feel fear for speaking up, because whilst unfortunately there is a lot of caregivers and parents that can fall into a bracket, for an example, of FII, fabricated and induced health and illness and such forth, the more that parents maybe bang on the service's door as such and plead and really ask for that support, sometimes that can get some alarm bells clicking in some people's heads in these services. And I guess, what would you maybe say to those parents in that position that may feel looked through the microscope but actually fearful? Because I know firsthand that I love all my children unconditionally, and one of my biggest fears would be to ever actually lose them. And although I knew that I was the best mum at that time that I could be for all my children, and whilst my daughter was being assessed, that was still at the back of my mind. And I was actually scared to talk up any further. So actually I was kind of suffering at home myself and things were getting worse. So what would you say to parents maybe living with that fear and struggling to speak up?
I mean, a lot of the times what we say to families is we're a strength-based service. So there might be needs, and yes, there might be risks, but actually everybody has resilience. Whether that's very small resiliences that we can build on, they're still there. And we have a lot of those conversations with parents about, we're not coming in to just focus on the risk or to make assessments about how bad a parent you are or how badly behaved your child is. That's not the language that we use. What we're doing is to try and work alongside parents and young people to identify, what is the challenge, because what we're seeing as a challenge might not actually be what the family are experiencing, and for them it might be something else. So we try and work alongside them on quite a bit. And I guess we're not a mental health service in the sense of we're not clinical, but we have people with life experience of mental health, or who do have some work experience with within the mental health services. So for that, it's we're able to bring some of that, I guess, human sort of side to it as well, that everybody experiences these things. So everybody experiences a drop in their mental health, especially after COVID.
Absolutely. And I think that's a really valid point, actually, that these professionals who are in these services, nobody's actually 100% absolutely perfect, and they may have their own trauma experiences and things like that. And do you know what, for a long time actually I had a bit of imposter syndrome, and I was quite taken aback a little bit from my experiences with going into the journeys of discovering that 2 of my children were neurodivergent. And I guess challenging actually that there's some professionals that can take a lot of lived experience. I think that's really important, because when I had my children, 2 of which were actually born really prematurely, and the highest consultant actually in the NICU unit was covered in self-harm scars. And I thought that was really admirable, that somebody who was looking after my children, you could clearly see there was an illustration of past trauma or whatever her story and experience may be. But it took that for me to actually break my own barriers almost. And I feel that in the past I always thought, well, if I turned up to a job interview and I have my scars from when I was a child and the battles that I went through, and obviously they're still a part of my identity, and I was always worried that I would never get that job that I wanted and things like that. But now I actually realise my greatest strength is my lived experiences. But I think unfortunately a lot of people have in their heads that sometimes maybe professionals are out to kind of have that catch on them, or they haven't had that experience, they don't understand what that's like ultimately as well.
I'll maybe just interject there and firstly acknowledge what you're saying, and I'm sorry that you've had that experience. I know as a health professional, I'm sure all of us would agree that that's never the intention, that we want families and parents to be feeling that way. the key for my role within health visiting and school nursing is that relationship building. So building that trusting relationship with families to be able to have these really difficult conversations around, actually, this is not good enough for your child, but these are the things that we can do to improve on that. At the same time, saying you're doing really well in this situation and acknowledging these bits as well. But we can only have these difficult conversations by firstly building that relationship, and that is about giving a bit of yourself as well. So you're saying bringing that lived experience. As a health professional, we're never divulging our entire past to our clients, but you're naturally giving a bit of yourself to build that relationship, and that's so important. You know, going in the door straight away and having difficult, challenging conversations will never work. It's about building that relationship first.
Yeah, no, absolutely. And I'm curious as well, is there kind of guidelines that's possibly followed in the sense of having those difficult conversations of when, you know, there is ultimately the conversation of this is great and you should be continuing in this area, but where there's maybe areas that's not okay. My question is, what's not okay?
That's a really difficult question. It's such an individual thing. So we'd be very much looking at that child and that family in an individual environment to decide what is good enough and what needs to change. So there's not set rules and regulations around that. It's very much about that assessment for that individual child and family and what the impact is having on their lives.
I think one of the important things that differentiates child and adolescent mental health services from adult services is that we use quite an integrated approach. So it's always multidisciplinary team involvement. So yes, at camps you may be seeing one clinician, but that clinician's drawing on the experience and the knowledge of the whole multidisciplinary team. And I think what we also work within an ecological model, which means we look beyond the individual, even beyond the community, to kind of the whole system. And I think that's a really important thing for families to remember and bear in mind, because we understand how difficult it is to raise children in this environment. There's this cost of living crisis. It's a struggle just to get, the healthy food. Then you have to make sure there's enough money for, extracurricular activities, heating, and those are really, really important things. And I think what's really important is whenever we ask parents how they're doing, it's not to judge them, or it's basically we want to know what's going on so we can support them. Because the thing is, at the end of the day, the child is not an individual, they're part of a unit. And that family is part of a community. And that's why the NGOs are just so, so very important, because especially with the service that CAMHS is rendering and the way that the NHS is structured, we're rendering a service from an individual level. So as a clinician, I'm just seeing one patient and their caregiver at that moment in time. When they leave, they're in that community. And so that's why it is so important that families be aware that they are not alone, and that CAMHS is not the only service. There are absolutely wonderful NGOs and friends and family and services available. And the thing is, what we need to do is raise awareness of that service, because at the end of the day, child and adolescent mental health care, the majority of the work that we want to do, especially if we're working with very young children, is family-based therapies and non-pharmacological interventions.
Absolutely, yeah.
And so I think it's really, really important that, we just push that, community interventions are, one of the things that work best, because especially if we are encouraging social networks, that's one of the key things, and that sets you up for the rest of your life. So it's all about finding your tribe. And I think especially during adolescence, you can lose yourself and lose your tribe. And sometimes, adolescence can be quite challenging, and they may not turn to their parents, and other adolescents, may not be the best, individuals, but especially if you've got an adolescent who's, been through the CAM service, that person has that lived experience. They can share that. And I think that's an incredibly valuable thing, so that even though we cannot reach every single child, at least, the children that we do see can also advocate for their peers.
It's really about getting the right care at the right time by the right people, isn't it? And that right care, taking it back just even to that keeping mentally healthy. We're not talking about diagnosing an illness or anything like that. It's getting the right thing at the right time. In my case, I'm doing a lot of work with PEEP at the moment, which is a parenting program, and that really builds on parents' confidence. It builds on their relationships with their children. That in itself's a challenge, and that's sort of stepping you on a good foot to kind of moving forward as a parent, as a family unit. And that's nothing to do really with clinical mental health. So that's the sort of how diverse. It's such a complex issue, mental health. You've got hormones, you've got your environmental, your economical, everything, that contributes to it. So it's not a one fix is all.
And that's why I think we must just acknowledge how admirable it is that despite all these challenges, these parents advocate for their children and bring them there. Because honestly, we would not be able to do our jobs if the parents did not bring their children to us. So I think it's really important for parents to understand that how proud we are that they are helping their child. And if you do feel that you have been judged, please raise that with us, because the thing is, no one wants anyone to feel like that, but often we cannot take action unless we know.
And often, as a professional, we will be kind of busting those myths in the first session, kind of asking about your fears, asking what you're worried about. Now, you might not be able to share those straight away, but often, it is about making those connections, building up trust with a professional. So that's about kind of raising those fears, letting the person raise those fears and discussing them. But something else you touched on as well, which you both have just also touched on, is navigating the system, and that can be incredibly hard to find what's out there, how to access it, and sometimes you do need to be an advocate for your child. And sometimes it's about finding the right professional who has those links, who can link into the different services, who knows what's right for you. That might be your GP, it might be a health visitor, it might be a different professional that you trust that can link you into all those services, because it's incredibly hard to navigate the health service or all the different services out there as well. And you do have to be the advocate that raises your children's needs.
Absolutely. Do you feel there's a difference in the services between child community health, CAMS, the young persons department? What do you feel separates them all but still keeps them under the umbrella as such?
I'm learning about the system, and I can tell you there are people in the system who are telling me the system is constantly changing. So we're working in a very dynamic system. But what I've come to understand, and I'll encourage my fellow panelists to please add on, is that in terms of community child health, we're dealing with children who are not yet in school, who are just beginning. And so any major challenges, behavioral or any other things that have come up, those are dealt with by community child health. So sometimes things like an autism spectrum condition assessment, that can be done by community child health. Also ADHD assessments. And what happens is once the children are in school, one of the pathways they're referred via is through the education system.
Yeah.
And so that's kind of an important thing to bear in mind, because what I have noticed is sometimes there is a discrepancy in what parents are finding difficult and what school finds difficult. So often parents are like, we cannot handle the child, we're struggling, and they ask the teacher, how's things going? And the teacher's like, oh no, they're okay. And sometimes we do see that discrepancy. And the thing is, if you as a parent are concerned about your child, it's really important that you raise that. And one of the avenues would be, as Emma mentioned, through the GP.
Yeah, and I think it is, navigating all these different systems as you've come back to. What are the different? These professionals all work together. So if you come into one system but they think it's better for you to be in a different place and that will meet your needs better, they work together. We work across people with the community as well. So we're trying to get the right intervention or support for that person, because there's no one size fits all. Everybody's different. Everything that you do is based on the individual and their individual needs. And so community child health, for example, in the past I've worked very closely with them, doing joint assessments. There's multiple ways that if you're sharing with somebody, they hopefully be able to access the right services, the right supports for you across a range of systems. But it's about kind of finding somebody you trust to be able to share that with in the first place.
Yeah, I think the trust is a key point in this. Yeah,
there's legislation that is being realised truly on the 16th of July, and that's your United Rights, for the Child's Conventions, the right. Can I get it right? Can I get myself? Anyway, the UNCRC is basically ensuring that these rights are enabled. It's been incorporated into law. So that I think will have a massive impact on however services should be working together and working with families, because that impacts on anybody under the age of 18 and even little babies, so that's the family with that baby that will ensure that their rights are enabled. And you've also got the promise as well, where one of the factors within the promising is about scaffolding, which are the services around, and that is getting that right for any child or young person. It's kind of focused on care experience, but it's actually any child or young person. So there is a big common theme there that should run through all of that, and I think with that being incorporated this year, you're going to see quite a bit of shift in the way people are working, the assessments, those connections, hopefully making it a bit more streamlined for people.
There's another service in NHS Grampian as well, the Parent and Infant Mental Health Team, which involves the perinatal mental health team, the infant mental health team, and the maternity and neonatal psychological interventions team. And they're dealing with pre-birth and children up to age 3 in the infant mental health team anyway. So they're dealing with these really early childhood challenges and parenting challenges as well.
I think that's really important as well, is to normalise as well that maybe the parenting challenges is quite a broad spectrum. I'm quite a lover of psychology, and I've got a vast passion and education around attachment styles. And I think attachment styles play a huge role in the relationships, importantly, that we have with ourselves. But it's really interesting to see how they actually play out when you actually have a child, and how that relationship can ultimately be built from. Do you think, let me think about how I'm going to ask this question. Do you think that there is a lot of services there for support, that if there's not actually poor mental health going on for a young person, do you think that there is good services that can help actually recreate bonds between parents and help support them through that challenges maybe? I know that for me, when my daughter was diagnosed with ADHD, I didn't have a clue what ADHD is, and to be honest, I still don't. I can just tell you her character and what my daughter's like. And I actually went on a PINK course, and it was through CAMS, and it was really insightful because it allowed me to see how my daughter looks at the world around her through her kind of tunnel of vision almost. But I think some people may not even realise that there are these courses out there, or there is the services that can help with, for an example, bonds. I think actually with my daughter who has ADHD, she's very, very impulsive, and sometimes she doesn't have a concept of personal boundaries. So she'll come running right up to you and she'll kiss you all over your face. And to me, that actually was something that I was quite worried about, because you see a lot on social media about parents kissing their daughters or their sons on the lips and how it's inappropriate. And I always had at the back of my head, is it appropriate that I'm letting my daughter give me this form of affection? And with my attachment style, because of the way I was brought up and the way that I've had relationships in life, I didn't realise that there was part of my relationship that I had with my daughter where I struggled to keep that close bond, fearing that the way that she was maybe hugging me or kissing me was inappropriate. And I guess what I'm trying to ask is that whilst I found the pink course really beneficial for me, how do you think maybe things could change for people to be more aware that these things actually exist?
I mean, I wasn't aware of anything like that, if I'm honest. So, I mean, I guess I'm in a different position. Like, we work with children from 12 to 18 in Aberdeen, and a lot of the young people, when they are looking to link in with CAMS, that will be social work that would take that forward for us. We will maybe support them to go to the CAMS appointments and support them to put healthy things in place, but we don't often make that referral. So knowing that there's things like that families can go to, like I'm considering families that I've supported, we didn't know that. They didn't seem to be getting that information from CAMS, but if we as a service knew that, then we could have advocated on their behalf and on the young person's behalf to say, well, actually, can they take part in these sort of training and courses that'll support them in the community. So it's interesting to hear that.
I think it's also important to note with the pink group, and Freya can correct me if I'm wrong, I believe that the young person has to have a diagnosis of ADHD,
right,
and that would have been made either through CCH or through CAMS. So I think, and what I kind of want to know is, are you asking kind of, there's that period where parents don't have a diagnosis but they're like, something's going on. Are you asking what services they can access at that point or post-diagnosis?
Both actually. And I'm actually quite curious because whilst obviously this is not my field of expertise, but I am really curious of what the answer would be, is that before my daughter was 5, she was giving a working towards diagnosis by CAMS, and I'm quite interested in maybe, do you see possibly any guidelines in the future? Do you think they could actually be changed? Because I know that, for an example, my son, he was under child community health from the age of 2, and he had a working diagnosis of ASD from the age of 3. So from my lived experiences, I know these things are possibly actually having the right things in place. And I don't think at all, by the way, it's about any labels or any brackets that can be labelled towards your child. I think having insight of what's going on for your child allows the parent to have better understanding to maybe adjust their parenting, for an example. And I'm all for that, but I guess what I'm trying to ask in that sense is both sides of that coin. How can people know that these things exist in terms of the courses? And do you think with the guidelines, do you think in the future it's possible that they could change because it's quite bracket in certain age groups?
I think I'll come into the guidelines if that's okay.
Yeah.
Because guidelines are being constantly updated. So we work on guidelines clinically. For example, there's the SIGN guidelines in Scotland, which are a collection of the best evidence that exists to guide clinical practice. But they're constantly being updated. So they'll be updated when new evidence comes on board. So research is absolutely critical in the field of mental health and neurodevelopmental conditions. So it's really critical because it's such a burgeoning area and there's so much research going on that the guidelines are constantly updated. So there's a fast, rapidly moving research field that will constantly update the guidelines, and it's shifting all the time. I qualified as a clinical psychologist nearly 20 years ago. Some of the things have changed hugely since that time.
I can imagine, yeah.
Do you not think as well it's that kind of complex nature? I was working recently with a wonderful woman who's a mum, an adoptive mum of 3 children, who has made herself a specialist in fetal alcohol spectrum disorder. Now, in the UK, there is not really that much information. There's bits and bobs, but there's not a huge push around trying to get people who are not maybe on contraceptive or are planning families to really avoid alcohol, the zero alcohol, zero risk sort of message. It's a massively complex issue in itself because there's the whole stigma around not pointing a finger at a mum. If she hasn't planned a pregnancy, has she has she had drunk when she's pregnant? A fetus can be affected at any point through a pregnancy, and it could be on that spectrum. and you don't have to be an alcoholic to have a child that's affected by it. So being honest with your medical practitioners to say, I've actually drank, could, save you waiting years of pain, of not being able to be diagnosed with anything because you've never disclosed that you've drank alcohol when you're pregnant. So it's just a mix of everything, isn't it? There's so many conditions out there that it could, be contributing towards that.
Yeah.
Misdiagnosis even.
Yeah. Do you think that there is any links between young people in the services in relation to external circumstances? Because you were touching upon what you were just saying there, but what about poverty? Do you think that can really push someone who is quite a young child into having poor mental health?
I would say that the strongest indicator of poor mental health is socioeconomic factors.
I do agree on that.
I think that's predominantly, like, a lot of the families that we support, that is, it has a massive impact because the parents' mental health is impacted by that, because they are worried about how am I going to afford food, how am I going to afford bus fares to get to my job, how am I going to afford the gas and electricity bills, and then the young person then for a lot of our young people, because they're at that teenage year, but even probably when they're younger than that, when you look back on their development and their history with their family, that's had a massive impact on them in terms of probably taking on some of that worry. Then not also taking on some of that worry when you're talking about peer relationships, the impact that has on peer relationships, because you maybe aren't dressed in the same clothes, or you don't
had your clothes washed.
you haven't had your clothes washed, you haven't maybe got the facilities at home, like shower gel to actually go and wash yourself. And then we've had a lot of young people where that's then impacted their attendance at school, because they've then not felt motivated, obviously rightly so, because they've not had something to eat, they've not, their house is cold, they've maybe got younger siblings and they're worried about, actually, mum and dad are going to need this support, or I don't want to leave my younger siblings in this situation. And it does, like, a lot of our young people, that poverty is it impacts. You think it just impacts the little things that you really think about, like food, heating, but it impacts the social development, because it does isolate them significantly from that opportunities in their community and within school.
And I think that's why it's problematic to just have an individualistic focus on mental health, because it is, and I think when earlier on somebody mentioned ecological approach, it is a whole society approach that we need to mental health to improve the factors, the core factors like poverty, which impact mental health.
What about the flip side of that coin? If you have a family, for an example, who are in a fortunate position, who have good finances behind them, can you see people attending your services on the other side of that coin still come in because of the pressure, maybe? I know, for an example, my eldest is 12, and I know that some of his friends sometimes feel the pressure that they have to stick in, do the homework, because their parents have got really high position jobs. And there's children that I see around my children's social circles almost who have that pressure as well. Can you see that coming into your service just as much as the flip side of it with the poverty?
I think nobody's immune to mental health difficulties. It affects everybody and anybody, and there's really good evidence of a cohort study from they're my age. They've been studied since birth to my age. You can guess what age that is. And by that age, so we'll say mid-40s, 86% of people have experienced mental health. So although we know there's some core factors, socioeconomic factors, poverty, access to high quality housing, which improves mental health or contributes detrimentally to mental health. On the flip side, we also know that mental health difficulties do not isolate to specific groups of people. They can affect anybody. So it's not that we have some groups who experience mental health, some groups who don't. It's that it can affect anybody at different points in their life, and there's so many factors which impact on it, which we've all touched on today, that nobody's immune to that. It's like physical health conditions. Most people will experience it at some point. Most people experience poor mental health at some point in their life.
I would
Absolutely.
say as well, definitely when you notice that significantly at probably that COVID lockdown points, that a lot of people who had really good resiliences, so did have like good social networks, did have a job that they were going to and that they were enjoying, did have really good health, were exercise, all these things were taken away from them and limited. And I think a lot of people, like in my personal life and, you know, through work you speak to, and they say, actually, I'd never had challenges with my mental health, but that significantly impacted on me. And I would say the young people that we supported, even, you know, it didn't matter if they were facing poverty, because they maybe did have, you know, peers in the community that they could associate with, or their families had that. There was some resiliences that were keeping them kind of going, and then once those minimal resiliences and resources were taken away, a lot of people ended up in a really awful position with their mental health. And I would probably say, like, we're still seeing, you know, the impact of that for some of these children, probably more for the kids that we support who were maybe in a transition between primary school and academy, and now they're, you know, they started academy maybe after the lockdowns and all this schooling and all these other bits, and don't have those social skills, those social networks, don't have an understanding of, you know, the school dynamics, maybe have felt like they've fallen behind within education, and the impact that that's all had on their mental health. And I would probably say an ongoing impact that we're going to see over the next few years for these young people is going to be significant.
Well, worrying about their future, what their futures hold, you know, what they have missed out, you know, having actually those, you know, young people will have aspirations, but it's like, how have they been affected by, well, not knowing what the future, it's such a chaotic world at the moment, and they are like sponges, you know, they'll take anxiety through their parents, they'll be seeing stuff on the media, the news, you know, all this world stuff that's happening, that'll all impact on how young people are feeling, or how they respond to that.
We don't have the flexibility at this point for people to self-refer, or for GPs to refer, and all those things. So, but I would probably say not being able to have, or not having those resources in your local community where there is a service that can maybe embed you into something happening locally within one of the hubs, or you know, take you back into school and support that gradual transition back in, or allow you to have some sort of social connection. So like for us, we're relationship based, so that, you know, we're not a time limited service, so some of our young people we've worked with for like 3 years at a time, and a lot of that, you know, it's because we recognise that for significant change to happen for young people, especially around their mental health, that's not a quick fix. These are things that they have to learn, and I guess it's a cycle of change as well. We do know that everybody will come back round and at some point go, you know, we'll need that support again. So we don't often do that in a time restricted way, but I do think for us, you see a lot of change for young people when you look at other resources and other options for them. I mean, for some young people, obviously medication might be necessary.
It's been that opportunity to get in there early before, you know, that medical model is that kind of last result, because you maybe the whole prevention side of things, there maybe could have been that.
Because I think, especially, you know, when we're talking about medication, and I mean medication, I think there's certain individuals who may view it as a quick fix, but you know, it's not a quick fix. It takes time for it to start working, and so especially in our young people, especially in our children, we really would not just say only medication. If we are using medication, it's going to be therapeutic plus medication. And I think that's a really, really important thing for parents to, you know, remember, is that, you know, we prescribe when we feel it is definitely needed. And the thing is, medication, it's kind of not okay in anticipation of something bad happens. That's not how the medications work. It's to treat a psychiatric illness. And I think it's really important to remember that having anxiety is very different from being diagnosed with an anxiety disorder.
Absolutely. I think my son actually used to be on melatonin because he really, really struggled with his sleep, and there was at one point in time that was literally not just his but the household's lifeline, and there was a time and a place for it. But equally, I've had the experience where my caregivers, when I was a child, thought the best thing for me was medication, but I didn't enjoy being on medication because I felt like I actually had no feeling. I I felt quite actually numb. And a lot in my adult years, I've worked on exactly who I actually am as a person, started setting boundaries, started looking at my attachment style, started looking at my inner child trauma and rewiring that. What would you say is maybe beneficial about maybe not having the medication whilst also supporting it? If it works for someone, I think that's absolutely fantastic, but where it's not actually a method of what's working, what do you think could be the greater benefit by actually doing the work and utilising the resources around us?
I think one of the key things, and I'll use ADHD as an example, is often what we find is our first line is always non-pharmacological. And so there's these assessments that we ask the teachers to do and the parents to do. There's even some child self-report. And what we do is we look at the child's functioning across different areas. And often sometimes the child would be functioning okay at school, and there's specific challenges at home. So if we're seeing that discrepancy, then we're like, okay, this is unlikely to fully benefit from medication. Let us try these other things primarily without medication. And then if you feel okay, especially sometimes when children get older, so the workload increases, there's the stress of socializing with peers, it becomes more challenging for them to bear that cognitive load. And then you see they're beginning to struggle academically, and then you see that loss of function. And at that point, what we do is we reassess the need for medication. And the thing is also, especially, and I know I do this when I'm prescribing, it'll be a child and they could be kind of 7, 8. I will speak to them and ask their opinions about medication.
I think that's really important as well, that the children have a voice. We're nearly running out of time, but I do have a last question of what is Grampian currently doing to help support our community of young children who are struggling with their mental health?
I personally think that there's a new generation of clinicians and services that have come into Grampian recently that are targeting supporting children and young people and are more aware of the needs and supports that are being not demanded but are being required. From my own personal experience, when I was younger, I was diagnosed with both ADHD and autism, and there wasn't any supports around. But now, with the young people that I can see, there are multiple services that there's one-to-one support, parent support, family groups, and that's all available to families. But that wasn't there a long time ago. So there is big changes that are happening in Grampian, and I think there's more awareness within schools and within services that is making it easier for individuals and families to approach these services with their struggles.
There's a wide range of community services, groups out there. There's a wellbeing festival that's going on through the whole amount of May that will be giving people opportunities to have taster sessions. There are groups that encourage parents the benefits of play and enjoying each other. There's that's the kind of the wide range, and obviously the poverty element. There's work going on to try and ensure families get the money that they need, the kind of cash first approach. So there's a huge, I guess, amount of work, that socio environmental sort of side of things that's going on. It's just I suppose knowing where to go. Aberdeen, we've got ACFO, who are a great website that helps you get in touch with lots of different sort of charitable organisations, whether it be food banks or support groups or anything like that. Groups that support with the inequalities around mental health. We know that LGBT, anybody that's LGBT plus would be kind of more at risk of ill health, ill mental health, poor well-being. So there's lots out there. It's just sort of finding them and being involved in your community is one of the sort of best ways to do that. There's kind of key people in your community that should be able to help getting involved with groups and all that.
I think people are often afraid to ask, or not afraid, maybe just feel
Judged.
Again,
they don't want to
judged
feel
and
judged,
feel that they're being looked at through like a microscope, as you said. But we're not there to judge people or their children. I work very closely with many young kids that either have a diagnosis or are being assessed, and the support that you provide them, they don't just forget about it, they take it along with them, and it does last forever. That the support that you give them at that time is something that they won't forget. Their families are always very appreciative, and if they ask, there's a multitude of supports that are out there. It's just that I think there's a lot of stigmatism against mental health and having a label or a diagnosis, but it's nothing to be ashamed of or to be afraid of, or you're to feel like you're going to be looked at differently.
Yeah, I would probably agree that for like the Grampian, or for us, where the citywide is ACVO, like we're I think for third sector organisations, there's a sort of forum that we come together with to talk about what are other third sector organisations doing, where is there gaps that we can all bridge by working together, by working in partnership with the statutory services, and I think that's something that Aberdeen's getting really, really good at, I would say, like all the services, whether it's statutory, medical or third sector, all coming together to say, how do we actually work together on this, and give young people different opportunities.
With Aberdeen as well, we're doing a lot to kind of streamline different funding. So ACVO has the mental health fund annually. Our team has health improvement fund. I know there's Fairer Aberdeen. So what we're trying to do is get them streamlined better, so that if community groups want to say they've got an idea that would work for them around well-being, one of those funds would be the ideal type of fund. So there's lots of kind of unseen stuff, I guess, going on as well. Just knowing that we want things to work better for communities, because communities have often got the answers as well. You don't want to be doing things to people, because it's the communities that often know the answers for these things.
And I think what you're touching on is a very important part of research, the participant engagement model. And basically what happens is, yes, you have a service, but through iterations you just build on that, and you basically then design a service for that community. And I think it's in the best interest of communities to also advocate for themselves, because different areas may have very specific challenges. Like one area maybe there's a very heavy substance use, and the thing is, yes, we can rely on the police, but I think as a community, what we must remember is that as a community, the people need to come together, and to remember that we do have that power, and to not feel abandoned, because no matter what, we have each other. And sometimes it's hard to see that, but I think, like Freya was saying, to ask for help, that in itself is very powerful.
Thank you very much for your experiences, and most of all, thank you to the listeners. If you have been impacted by any of the issues raised in this podcast, remember you are not alone. Help is available, and you can find those services and helplines at the end of our podcast.